everyone. Xin chào Vietnam. Really nice to meet you here again. It's really my pleasure to share with you about the role of exosome after the procedure care and also enhance our skin quality. I think the trend for the skin care right now is about the skin quality and skin longevity, right? We want our skin to be healthier and longer with the very perfect skin, and we have evidence that our laser and energy device can enhance your skin longevity by more synergistic effect of the collagen production and reduce of the enzyme that will destroy your skin. And we found that exosome show the roles, promising role to enhance the skin's longevity. So as you learn from the previous professor, that exosome show many function: anti-inflammatory, anti-cancer, promote hair growth, anti-melanogenesis. So we can apply the exosome in our aesthetic procedure. And the concept is that right now we can combine with almost all of the procedure, like microneedling, fractional laser, IF microneedling, or my favorite is the fractional picosecond laser. You can collagen, more collagen stimulation and production, and with exosome you have the anti-inflammatory effect, promote wound healing, regeneration, and you can get from the totally combination, you can get the decrease of the downtime and improved of the treatment result. Let me share the result with you. This is the first randomized control study about the exosome in laser treatment. They performed the fractional carbon dioxide laser for the whole face, and one side randomly received the stem cell, the exosome ASCE Plus. And what we found is that the combination with the fractional CO2 laser and exosome showed the better treatment efficacy and also reduce the downtime after the treatment. So when I get exosome, I also performed pilot study to see the efficacy. This is a bit face side pilot study. You can see I performed the fractional CO2 laser, and what we found is that the site treated with exosome show faster recovery. And this is the real case situation. We performed the fractional CO2 laser, very common procedure, right? And what we found is that exosome show better skin recovery. And you can see from the graph, exosome show faster improvement of the downtime after the laser treatment. And this is one of my favorite machine, the fractional picosecond laser. With our exosome and with exosome, you can see significantly, clearly difference in the reduction of the redness and downtime. This is without exosome and with exosome. And day 3 with our exosome and with exosome, you can clearly see the significant difference with using the exosome to improve the skin quality. And the more session of the application of exosome, you can get better skin quality. You can see the faster improvement. This is the day 3 with the exosome, more session, you can get better skin quality. And I also, because I love pico and I love exosome, I want to see that is there any synergistic effect when combine the fractional picosecond laser, the whole face, and one side randomly apply with the ASCE Plus exosome. What we found is that the concept is that we use the fractional picosecond laser, we create the laser-induced optical breakdown that will stimulate more of the collagen production, and this technology also could be the laser-assisted drug delivery. And then we combine with the stem cell-derived exosome that have many functions: anti-inflammatory, promote collagen production, and anti-melanogenesis. What we get is that the site combination with pico and exosome show significantly better result in the term of the decreasing of the downtime. And this is show the picture. You can see the site treated with the exosome show significantly faster recovery after the treatment with picosecond laser. And this is the other case. And how about the result? We found that the site treated with the exosome show better acne scar improvement. This is the example of the case. So you can use, actually you can combine ASCE Plus exosome with any procedure or energy-based device. You practice microneedle, fractional CO2, or one of my favorite is about picosecond laser. You can shorten the downtime after the treatment and also enhance the treatment result. And how about in our market, we have so many skin booster and skin healer after the procedure. So I performed the pilot study again. I performed the picosecond laser on the skin, and then I used conditioner media extract, the serum, and also I use the Exosome topical. But I combine with one of the most popular, I think also in Vietnam also, the polynucleotide, but I inject this type after the procedure. Let's see the result. This is day 1, maybe not so much difference. Day 3, you can see some difference. And day 3, 4, day 5, we found that the site treated with Exosome showed fastest healing. And how about the graph? We found that the site treated with the topical Exosome showed the fastest improvement after the pico laser. And followed by, surprisingly, is the conditional media serum, and followed by the intradermal injection of the Exosome. This is so surprise to me. So, and we found that after the laser treatment, if you use Exosome, you can get the better improvement by the score evaluation. And how about the other treatment? So I perform on the patient, right? The speech phase again. The one side treated with Exosome topical application, and the other side, again, I compare with the intradermal injection of the polynucleotide or PN. What we found is that, interestingly, the side treat, I think we know already, but the site treated with topical Exosome show faster and significantly improvement of the downtime after the picosecond laser, better than the polynucleotide injection. So you have to, I think this is quite important finding, because just topical application show the better result than injection. So I think this is very interesting. This is day 1, then day 3 with Exosome, and this polynucleotide intradermal injection. So I think this is very interesting. And we found that topical Exosome show better result in the improvement of the downtime. And the other popular procedure is fractional RF microneedling, right? I use many brands in the market, and I think it's very popular in Vietnam also. And I again performed the speech phase study. One side, topical Exosome application, and the other side with intradermal injection of the polynucleotide. What we found is, interestingly, this also impressed me, that the site treated with the topical ASCE Plus application show better improvement of the downtime after the treatment, significantly better than the intradermal injection with the polynucleotide. So I think this proves the efficacy of the ASCE Plus exosomes that show better improvement of the downtime and skin quality when compared to the polynucleotide injection. This is 1 hour and 12 hours after the treatment. And again, topical exosomes show better recovery time after the procedure of the RF microneedling. And we have the ASCE Plus exosome, right? And not just for the ASCE Plus, we also have the moisturizer. One of my favorite product is about the Exobalm. We have the low stem cell derived exosome in combination with the active ingredient like ascorbic acid, medicazosin, dipenthiol, and niacinamide. This are the very good ingredient for the skin improvement. And we report this using the combination of ASCE Plus and Exobalm in the treatment of severe recalcitrant seborrheic dermatitis. We can calm down the inflammatory skin disease using this combination. And this is the real guy. His wife apply the cream for him. He's a very manly guy that do not use any product before, so his wife have to apply it for him. And how about the how we can employ the Exobalm or exosome moisturizer in the procedural dermatology? So I perform the speech fade again. I perform the fractional two laser, and one side randomly apply the Exobalm after the procedure. What we get is the site treated with Exobalm show faster improvement when compared to the moisturizer. So I always prescribe the patient with the Exobalm as the home care product after the laser or any procedure. And this is after the picosecond laser. What you can see is that you can observe is that significantly the reduction of the redness can observe after a few hours, 2 or 4 hours after the procedure. So this is a very good option for you to prescribe the patient at the home care product. And another speed phase, Exosome and picosecond laser. You can see the difference in the redness from day 2 or day 3. So I like this so much. Another product that is the patient love it. You keep the mask in the refrigerator and then apply the mask after that. Okay, sorry. And then apply the mask on the patient's skin. You can see the significantly reduction in the burning sensation and redness you can observe after only 30 minutes. So this is very good. The patient love it. They buy it and apply at the home also. And how about the home care product? So when I got the home care product, oh, this is look really good. So I would like to try again. I have experience. I would love to share with you 1 month result applying with the home care products, okay? And first, let's begin with the Exosome. And this is the case with this, I use the Antra 3D image to analyze the skin. You can see this case have the melasma, prolonged melasma for a long time. And what is her problem is that she have the catate hypomelanosis from the previous laser treatment and the sun damage. And what we get is that we can get the improvement of the complication like the catate hypomelanosis like this, and her pigmentation got improved, and the vessel, the redness got improved also with the Exosome. You can see the catate hypomelanosis from the previous sun damage and also the laser treatment got improved. Another case, you can see that improve of the pigmentation like this, melasma, and also improve of the skin texture with just only the application of the Exosome. And also, not only for the pigmentation, but we can improve the wrinkle, the folds with using only the Exosome. And this is also the nasolabial fold 1 month after the Exosome. I think this is very good product. And the other product that I got in is the calming ampoule brows. Yeah, they have the stem cell derived exosome in combination with many ingredients you will learn after from Mr. Lee. What we can get is that we can get improve surprisingly. We can get the improvement of the skin, like the lifting effect of from the nasolabial fold, and the pigment. You can get the very good improvement with the pigment improvement. You can see only 1 month with the calming ampoules. The result is fantastic. You can see the pigment improvement with just 1 month of the ampoule, calming ampoule brows, and also the folds again, and also the pigment got improved with just only the ampoule brows. And this is one also. This is nasolabial fold and pigment improvement. And another interesting product that I love so much is about Exosome, but for the hair. So they call it Exosome HR. They're composed of the low stem cell derived exosome with growth factor, and they add the poly or oligopeptide that have a very good function for to promote the hair regrowth. What is the result? Usually, I always treat the I publish the technique using the fractional picosecond laser to promote the hair regrowth, and then I always combine with the green ASCE Plus, the HILV, and then we have the solution for the patient to apply at home with the technique of 5 line, and on each line we apply 5 points of Exosome and also give a gentle massage. What we can get with the result is that this is 3 months after. Only in this case I use just only the Exosome. Only 3 months, the result is fantastic. It's 3 months also, thickening of the hair. 3 months also, thickening of the hair. 3 months only. So I think this is a very good product. And in the case with more severe degree of hair thinning, I use for a longer time, for 6 months. You can see, I think it's obviously thickening of hair. So I love this product so much. I always ask a prescribe for the patient. You can see. And we can not only grow the hair, but for the eyebrows and eye rash, we can enhance the eyebrow and eyelash. I think every girl, especially for the Asian, we like the thicker eyebrow and eyelash, right? So this technique not just only grow the eyebrow and eyelash, but we can make it darker. Every girl like that for sure. Let me share with you the result after this. And for the procedure treatment in combination with the exosome and also exosome moisturizer, you can use in combination with any procedure in your practice, microneedle, pico, RF microneedle, CO2, erbium, or pico. And after that, you topical apply with the exosome, maybe add the electroporation, right, to enhance absorption. And the patient love the exosome mask so much, this mask, let them keep in the refrigerator and apply to them. They will decrease the burning and pain sensation very fast. And the concept of the use of the home care product or the exobalm is about the microdose or maintenance dose of exosome. They will improve the treatment result with the application of the home care product. So, and we also have another concept is the skin priming with exobalm or home care product. You can ask the patient to apply the exobalm or home care product, the calming ampoule, 2 or 3 weeks prior to the procedure. You can improve the treatment result. Let me show you. This case I performed the full beam, fully ablative CO2 laser. And then I asked the patient to use the exobalm 2 weeks prior for the treatment. And this is the downtime. The site with the pre-treatment with exobalm got faster improvement than the site with the control. And then this is the downtime after the treatment. And this is the just only apply the exobalm, the patient got improvement of the pigmentation and skin firming. And how about this one? 2 week post-procedure, you can see the obvious significantly tightening and decreasing of the pigmentation. So the skin priming concept is very useful and essential. We improve our patient's skin quality, skin hydration, and improve the skin response. This is 2 weeks after. You can see the nasolabial folds, the pigment got better with the site treat with skin priming with the exosome. And this is I would like to share with you. Yeah, the skin firmness, the skin in the site with the priming with the exosome and exobalm. It's significantly different. It's the skin tension, right? So I think this is a very good concept. So, and also not only for the CO2 laser and also the RF microneedle, you can use the concept of the skin priming used with the exobalm or calming ampoule 2 weeks prior for the RF microneedle. What we see is that you can get this site, you can get the better result of the treatment, acne scar, acne, wrinkle, and this is site control. You still got the improvement, but the site treated, pre-treat skin priming with exosome get better result. So this is the take-home message for me. For the exosome, you can get the anti-inflammatory effect and also regenerative effect. So you can have significantly decrease the downtime after your procedure treatment and also improve the treatment result. And for the exosome home care product like calming ampoule, one of my favorite right now, is that you can use as a maintenance therapy as the low dose or maintenance dose of exosome. And the interesting concept is that we can do the skin priming, prepare the skin of the patient for the major procedure like any laser or any surgery. What for? Is for the better treatment outcome. Thank you so much.